So I will turn the floor over now to Jenny Chang, who will facilitate the discussion.
Thank you, Cheng Sim, and thank you to all the speakers and our guests here today. I'm one of the contributing members, organizers of PANA, which has really worked hard to hold down this progressive space for APIs over the years. So thank you so much. I am a single payer advocate and current constructor at CARA, and I'll be moderating this segment today. And we really wanted to make sure our sponsoring organizations had a chance to say hello or a word or two. So if you're a representative from one of the endorsing organizations and would like to just share a few words, if you would raise your hand and we'll unmute you, be nice to hear from you. I might call on you because I see faces. Maureen, would you like to say a few words?
Okay, I just want to thank everybody. I'm Maureen Cruz, and I'm one of the directors. I'm part of the healthcare team. I'm the Medicare-for-All Los Angeles chapter team. And I want to just thank everybody who participated in this. Speakers, you were marvelous, not just for sharing your stories and for what you said, but for all the work that you've done, because every single person that has spoken on this call has really been involved in one way or another on the front lines for trying to bring healthcare justice to everyone. So thank you, everyone.
Do we have anyone from the Healthy Nail Salon Collaborative? I'm looking for hands. Anyone else from an endorsing group? I know there is. How about DSA? I see Kenyon. Kenyon, would you like to say a few words?
Thanks, I can speak, Jenny. Yeah, my name's Kenyon. I use she, her pronouns, and I'm one of the co-chairs of DSA-LA's Healthcare Justice Committee. And I just want to say thanks to PANA and everyone else who spoke or endorsed tonight. Like many of us, I've been to so many single payer events. I can't count them, but I can't remember the last time I learned this much in 2 hours. Or just an hour and a half now. So it was incredibly informative. It was really emotional. It also emphasized what a need there is for more events like this. So DSA-LA would love for anyone here to work with us. We'd love to work with you and support your work. And I think that there was a link shared in the chat, but I will share one again. So thank you again.
Thank you. Anyone else want to say a few words? Might as well move on. All right. So we received a lot of really great information, heartfelt information from our speakers. So if at this time, we want to engage with our community members. If you have anything, any questions or thoughts you'd like to share, this is really an open discussion, not merely a Q&A. I'm sure there's thoughts out there with all the information that was given. Just click on reactions to raise your hand. Shalom, would you like to unmute?
Yeah, good evening. My name is Shalom, and I'm a nurse working with the United Nurses Association of California. How do we pay this AB 1400? Briefly, can you summarize the main points? Who's going to pay for this AB 1400? Thank you.
That sounds like a good question for Carmen Consti, yeah?
Sure. People ask this question a lot, but we have to remember we can't afford not to do it. It's costing lives to keep the system that we have right now. But on the substance of the question, single payer would achieve savings through drug price negotiations, through getting rid of administrative waste from our fragmented healthcare system, of multiple insurance plans, by getting rid of the profits. And that money can be used to pay for everybody and to provide us more. So that's simply, we're already paying for it. There are different issues that, Assembly Member Calra mentioned earlier about, making sure that we have a financing plan, and those things can be worked out. There, it's not, I think I've said this before in other forums, but, it's not rocket science to figure out a tax plan. And hopefully in the commission we can hammer those out. But there are a lot of different options, and it's not something that's impossible to figure out.
You're not going to do some mooning.
We have another question from Zach. If you'd like to unmute.
Oh, yeah. Thank you so much. My name is Zach. My pronouns are he, him, and I'm from Silicon Valley, DSA, and a member of the new member of the Santa Clara County Single Payer Healthcare Coalition. One thing that I've identified and we've identified in the Single Payer Coalition is having access to translators and interpreters, especially like in our area, we have a huge population of Vietnamese speakers. And if you go into, like, I recently went into the census data and just did like a sort of survey of the 5 counties around us. And granted, like Spanish is like overwhelmingly the most spoken language outside of English, but there's a huge population here. I had no idea, like, growing up in the Bay Area and near San Jose, I always heard that we had the biggest population of Vietnamese people outside of Vietnam. And like, I didn't realize like what kind of barrier that was until I looked at that data. And then hearing tonight, like, that so many of our immigrant population here in California are like undocumented. And I had no idea that was the case for I believe you double API is the term that was used. Like, I had no idea. Like, I was so astounding and like just like mind blowing to hear. But going back to like my initial point is, it's difficult for, I've been looking into trying to find like pro bono translation services, and being we're very like, we want to reimburse people for their labor who are translating. So as a organization and as like individual pieces of the AB 1400 campaign, in our small areas, like it's really hard to balance that financial, like, we need more financing for that kind of stuff. And then also finding people who can actually translate and like can continuously, like, who can consistently provide that service without really like relying on the people that speak those languages within our chapter to carry all of that weight, because I don't think that's a good process to begin with. But I was wondering if you had any ideas around that or any resources, or if that's something that we could have further discussions on, or I'll stop talking now. Thank you.
Well, no, thanks for sharing your experience, your perspective. Do any of the healthcare professionals in the room have any thoughts on this? No? Well, we do have some questions coming from our steering committee members, and they had a lot of questions, a lot of important questions. So at this time, Chang Sim, would you like to pose a question at this time?
Sure. Thanks, Jenny. I was just wondering, people who spoke, like Chansey and David, and Keshi, working at the grassroots. So if we want to win AB 1400, we need to bring your communities, your constituencies into the struggle. So what do you see that one or two most important things that we could, that you think would be most important to build our support, for AB 1400 in your, with your constituencies or with your communities?
Chansey, would you like to give that a stab? I think you're on mute, or we can't hear you. Huh.
Can
I
you?
don't hear you. Do you all hear her? No.
No.
Oh no. Okay, well, we'll come back. How about some of our other speakers, especially, or if you work with any organizations, API organizations, what are some of the challenges you see and how we can mobilize? Chancey, do you want to try again? No, can't hear you.
You have to unmute.
No,
No, she's unmuted.
She needs to go into her preferences.
Or she might have to log off and back on because it shows she's unmuted.
Right.
The question Chang Sim's asking, I think it's important to talk about, and maybe Taiji, you can bring in, you work with a lot of API organizations, and David, you as well. What are some of the challenges you all are seeing in making healthcare single payer more prominent issue, especially groups that are working on housing and such?
Yeah, I think it's always tough. Like I know in the anti-eviction work that I've been involved with, it is such difficult work. You're working with like low income working class people who, they have so many day-to-day stresses. It's like even trying to organize a tenants meeting is tough because everybody's schedule is irregular all over the place and everything. And you're having to go through all of this stuff about informing them of their legal rights, with an approaching eviction notice. And I mean, I'm sure other people can relate, in terms of other work issues that are related. And it's always a battle to connect it to this larger healthcare reform effort. With the Save Our Seniors work, it's a little bit easier because, I mean, fortunately, AB 1400 directly addresses the exact central issue that's going on with that campaign with regards to bilingual, bicultural, culturally appropriate healthcare services. So I think many of the Save Our Seniors network members are on this call can attest to that. So that in that case, it's a little bit different because it's a perfect melding of the housing issue with the healthcare issue, right? When it comes to senior care housing. But I think for other activists that, like I tried to talk about it in the beginning part of the presentation, where I think we need to like reframe how we talk about some of these issues, right? So that the connection is there, so people understand that the connection is there as a given. Like people working on environmental justice stuff in the South Bay, right, should be able to link their work with the overall healthcare reform effort. And this is more of a challenge to activists to get out of their silo mentality. Oh, I'm too busy. I can't deal with AB 1400. I don't have time to do that. I mean, that's a really common thing, right? We have limited bandwidth and we're already so overwhelmed and, spread out. I mean, if we take that position, which all of us have probably stated ourselves at one point or another, like I probably did yesterday myself, right? But if we continue to hold on to that status quo way of operating, we're never going to like join our forces, on like centrally important issues like healthcare reform. So a lot of it is like, I think, putting a check on ourselves. Like a lot of endorsers, I'm going to be straight up and blunt. We had, a dozen endorsers of this program. A lot of those people didn't even join the Zoom call tonight, And granted, I know it's because they're super busy, like we all are, right? But I mean, we've got to get over this hump of this silo mentality and start staking out exactly where are we going to join together. And if we don't have if we don't have enough capacity to allocate to something something as important as the AB 1400 fight, then we need to start addressing how we're going to build that capacity. And I think that's the big challenge that we're facing right now.
Thanks, Taiji. Jiyoung, you have your hand up.
Yeah, so I also think that a lot of the activists out there are tend to be younger. I know that there are lots of other middle-aged and older activists. I'm middle-aged myself, but yeah, a lot of the people that I work with on other issues tend to be younger, and I think there's just a lack of urgency on a lot of their parts. I'm just speaking in generalities because there are definitely younger folks who are working really hard on this issue. But I think that the main thing is that we don't have the resources to get the info on this bill even out there. And so a lot of people just don't know about this bill. And so I'm actually working on creating an informational video about the bill. And I know people here have as well, but just to get people to even know what this even is. People know what Medicare-for-All is, but a lot of people don't know what CalCare is. And I'm talking even activists.
Thank you. Chancey, you're back in the room. Let's see if your mic is working. Could you unmute? Chancey, we don't hear you. No, I'm sorry. Dr. Rich?
Yeah, maybe try going to settings, Chancey. Something's off with your mic.
Dr. Rich, would you like to speak?
Yeah, I think that I think there are a lot of barriers to, trying to get this movement going. Obviously, there's a lot of money that's being poured into it from the health industry, from healthcare insurance companies that are trying to lobby our legislators. And, it's like what Dr. Paulson was speaking about, we're up against a lot. And I think in order to create this groundswell, I think it comes down to educating the public, getting them to understand that, what we have now is not normal, and that, that we can have a system that is much better. And oftentimes the first question you hear is that of funding, well, how are you? But the thing is, California is the 5th largest economy in the world. And much smaller economies have been able to create single payer systems. And as we heard today, ultimately, we're already paying for the majority of the healthcare system. If you remove all the corporate bloat and administrative costs and are able to negotiate fees and things like that, we'll close that gap very well. So I think that a lot of it just comes down to educating the public and having events such as this to get more people involved and more interested in. And I think what Taji was talking about, building coalitions, is very important. Getting us to all understand that, this is all these things are important to us, and we need to pull our resources together and get out there and make this known so that all the public knows of it.
Can you hear me now?
Yay, we hear you.
Okay. Okay. Yes, going back to the original question that was posed about how we could organize our respective communities. Well, I work with community members who are eking out a survival and just barely have time to take care of their own personal errands because they're working around the clock nonstop. And so it becomes a challenge for our organization always to mobilize them around any kind of issue or something that even impacts them directly, like healthcare. And so for us, we have to really, in our experience, because we've done so much organizing around so many different issues, whether it be housing or healthcare or combating human trafficking, modern day slavery, it's to make the campaign personal, relatable, and to make it accessible. So it's got to be just culturally appropriate, linguistically appropriate. I mean, they're all limited English proficient, and the majority of people we work with have up to only a third grade level of educational attainment, and undocumented, so always afraid to come out and come above the the surface, and so trusted voices. That's how they are able to really get the message through trusted voices. So Thai CDC, since we provide that safe space for people, and we are a trusted voice. When we basically reach out and campaign, etc., they know that it's coming from a source that they can trust, and so that's where we would start. But we have to make sure all the materials are culturally competent, and all the collateral materials, communication assets, are in language and culturally competent, and that trusted community-based organization and voice also be the organization to reach that community.
You brought up some really great points. I think it is those challenging gaps that we finding trusted voices like yourself to help us create the better program going in. We should work with you. David, you have your hand up.
Yeah, thank you, Jenny. Yeah, I think that within the API communities, as far as many of the working class folks and people like that, I don't find any real resistance to so to speak, unless some of the people have been sort of infected by industry propaganda. And you could tell right away, because people always say things like, well, what about this other stuff like public option? Well, what about this? What about they say that we can't afford it. So those people have been infected by industry propaganda. You just have to talk it out. But I think the overwhelming majority of people are for it, but they need explanations. And just like Chancellor was saying, in the correct, proper language, and the messenger is very important. I think that, for example, since so many people for years and years and years, the people right now on this call, even activists, they've been completely used to, demands. Stop killing us. Stop evicting us. Stop laying us off. That's all we know. That's all we think about. And that's all we demanded and fought for in the last 30, 35 years, ever since the 70s, ever since the empire struck back, the 70s. So getting rid of that thought or reversing that takes really, really a lot of effort. I didn't realize how deeply dug in those thoughts were. So when people hear things that are more quote unquote offense, we're asking for things. We're not just saying, don't kill us, don't evict us, we're asking for things. People don't get it right away. People are suspicious and they feel like, what? That sounds too good to be true. And so it's very difficult on that level. But once you get in, I don't think there's too many problems at that level, at the community-based level.
Thank you, David. Any other thoughts or questions? We don't have to. Oh, Taiji has his hand up.
Yeah, I'm sorry, I'm talking too much, but one thing that to address this thing about capacity, first of all, Chauncey's comments are really, really good, and I think that's so important that we have to get a critical mass of community leaders from various communities to buy into this. I can't go to a Pacific Islander and speak to the Pacific Islander community en masse, right, or other Asian communities where I don't speak the language. It doesn't work like that, right? But we need to build a network, even just starting with key individuals that can open up doors to have community-specific conversations, I think. So that would be a step. If this event it can help us move in that direction, I think the PANA Medicare-for-All committee, I think we've been talking about trying to set up presentations with different organizations and initiate a conversation like this. We don't have all the answers, right? We can ask people to talk about their stories. Like, you know, Keshi had a great sharing of the family story, their family story tonight, and those stories are not in any short supply, you know, like others were speaking to. And I think that's just the hard work that we need to do, and that's the challenge I feel that activists need to face. We cannot allow ourselves to be satisfied with preach to the choir activity. Like, that's kind of our measure. Like, how many new, you know, people are we reaching? I think that's the standard that we have to hold ourselves to.
Oh, can I also add that seeing in the chat here, I totally agree that, you know, our community, we rely a lot on getting the word out, message out through like the ethnic media. Thais read all the ethnic print media, listen to the ethnic radio, and also watch all the ethnic cable television programs and news programs, etc. So we, besides going door to door and going to community sites and going to churches and temples and doing all our outreach there, we rely on ethnic media a lot and all the different Thai community organizations to get the word out and get the message out. So by virtue of working with all of these community leaders in the different ethnic communities, you're also reaching people through their networks, like their churches, their temples, the ethnic media as well. And so that's where we should start. And some of you are part of the Asian Pacific Planning Policy Council, as Thai CDC is as well. And APCON just got awarded like millions and millions of dollars to do a lot of the COVID education outreach in multiple Asia Pacific Islander ethnic communities, subcontracting all of these ethnic community-based agencies like Thai CDC, where we've been doing all this COVID education outreach and distributing thousands and thousands of PPEs. And we're also creating public health councils at workplaces to organize workers and make sure that they are protected from COVID. So if we're gonna now go into like healthcare for all, I see a continuum there. Why not take advantage of what we're doing already around COVID and you know, move this further now to, you know, to address healthcare in general for everyone and eliminate, you know, the disparity in healthcare and all the structural issues in accessing healthcare.
Thank you, Chansey. Your comments have been really valuable, and I can just feel the motivation with our organizers. So we should definitely reconvene. Is there, if you all want to get connected with PANA and the work of, you know, preaching the gospel of single payer, AB 1400, if you could drop, if you can contact, there it is. Is that the sign-up sheet? Yes. Stephen just dropped a link in there. But this concludes our discussion portion, and I will hand it to Taiji. Thank you all.
Hey, everybody. I just want to say a big, huge thank you for everybody joining this important conversation. I mean, I was kind of blown away. I mean, I was part of the planning committee, as we all were, and you never know how these things are going to turn out. I mean, almost everybody stuck to their time. It was kind of shocking, you know, that we actually allowed time to have a conversation. But again, I mean, you know, this is only the first one we've done, and hopefully, you know, we've established some groundwork to continue and extend the conversation further. So please sign up at that sign-up sheet. Let's try to keep in touch. Anybody, there was a lot of posts in the chat about different activities going on. We're going to try to pull together a follow-up email to send everybody that registered for this event to try to keep the communication going. And hopefully we can set up more of these type of events. One idea we've been throwing around is start pulling together a speakers bureau, which maybe could include some of the same people that spoke today, you know, as we begin setting up more community conversations. So I'm really excited that, you know, I think this event gives us something that we can all build off of, and we hope we can continue working together and continue building this movement that we need to push this thing forward. Thank you, everybody.
Good job, guys.
Thank you.
Could we all unmute and just say CalCare AB 1400 just as an application?
No. Healthcare
AB
1400.
Medicare for all now. AB 1400 now. Pass the damn bill.
Yeah, really. Thanks, everybody.
Bye.
Yes,
Yeah,
Reggie.
bye-bye.